skit. It's going to be sort of related to physical diagnosis, and I hope you guys have a good laugh.
Can we flip it to yourself? Okay, I would say you can hold it and they can pass it along to the next person. Okay. Because they won't be able to face not having all this stuff.
Hello. It's fine. It's fine. I'll just project. Okay.
They can't hear you though.
They really can.
No, we can't.
Can you take a picture?
Hello. Hello. Oh, it's so loud. Okay.
All right, sir. All right, sir.
Hello. Is this good? Yeah. All right. Hello. I'm a second year med student, and my name is Anu, and I'm here to take all your vitals before you can be seen by Dr. Vidal. Is that okay with you?
Yes, that is perfectly fine with me. Nice to meet you, Anya.
Okay, so I want you to stick out your right arm for me, and I want you to put it face up for me. Okay. So I'm going to take your radial pulse because the radial artery runs through here, and I just need to check your blood flow. Okay. Your radial pulse looks just fine. It seems very healthy. So now I'm going to take a look at your heart.
Hey, Anu, what does each spot mean? Why are you doing it in 4 different places?
I'm glad you asked, because usually when we feel for your heart or we oscillate with the stethoscope, we need to check all the different valves of your heart. So right here on the right side, you might think, why are you oscillating on my right side when my heart is on my left side? But in reality, we need to check on both sides, because on the right side, you have your aortic valve. And then right here, you have your pulmonary valve. Down here, you have your tricuspid valve, and here you have your mitral valve. And we need to make sure all of these valves are opening and closing properly so that there's no interruption in blood flow. And if there were to be some sort of mistake, we would not hear the lub-dub sound that you usually hear when you check someone's heart. Instead, you would hear the sound of blood rushing through.
Oh, okay, I see. Thank you so much, Anu.
Yeah, so that concludes my portion. I'm just going to ask Dr. Verdon to take a look at you now.
Okay.
It should be very, very short, you know.
Okay.
We'll be back right in time.
3 hours later.
Hello. I'm so sorry for the wait. As you can tell, this hospital, from maybe the footsteps outside and the rushing people here, is very full, and we're quite understaffed. I'm so sorry for the 3-hour wait. Would you mind if what are you in here today for?
Yeah, so I've been experiencing a little bit of throat pain. I have this rash on my arm over here, and I have this like small little mole right here. I don't know if you can see it. It's like kind of small, so I don't know if you can see it. But...
So due to the sheer size of that, I would assume that that is the main thing that we're going to look at today?
Yes, that's my main concern today.
That's the main concern. All right. Well, do you mind if I palpate the area, feel around, and do let me know if anything, if you can feel any pain, if you feel any tenderness, or if you would like me to stop, if you can feel anything at all, just let me know. Do you feel anything like that? Anything at all?
To be honest, I don't really feel anything. I'm gonna be honest.
Nothing.
No, I have no sensation right there.
That is a little alarming. Well, let me check both sides, make sure. Let me see if you can feel something on one side. Can you put both your hands out?
Yep.
Or maybe a little lower.
Okay.
Thank you. And can you feel anything on either side?
I feel stuff on this arm, but not as much on this arm.
Only on your left arm.
Only on my left, yeah.
Could you do me a favor and try to like do this with your fingers? Could you do anything with your right thumb? Can you feel anything?
No, it's not really. I'm having a hard time moving it, to be honest.
Hard time. All right. Could you put your arms like this now?
Mm-hmm.
Can you feel anything anything along here? Nothing. That's
Wow.
once again, interesting. Well, let's Anu, do you remember the shoulder test that they taught you? You're a second year, they should have taught you it by now.
Yeah.
All
So
right.
don't be too concerned. It should be nothing major, but I would. Oh, I have one.
Oh, right.
I would like you to move your arm up like this. This is called flexion.
This works the pec major, and make sure that that is all functioning and all in all.
And then I want you to move it back. This is extension.
Just make sure that the rotator cuff is working perfectly fine.
And now you can move your arm back to its position. I want you to abduct your arm towards your body. And
Once
let me
again.
know if there's any pain at all.
Not at all.
Once again, this is working the pec major, deltoid, as well as the supraspinatus,
And
making sure
then-
it's all working fine.
I want you to abduct your arm. outward.
Similar muscles this way as well.
Okay. Was there any pain at all?
Not at all.
Can you do that with your other arm as well? Move it towards your body and away. Nothing different?
Nope.
Okay, now I want you to take both your arms and move them upwards. Like this. All the way up above your head. And move them. So if while she was lifting her arms there was a sudden drop in this region, it would look like this. That would mean there was an injury in the rotator cuff muscles. But it looks like you're all good, so we'll see what you can do for your mole.
So it looks like since you were able to pass that test perfectly fine, good job on it. It looks like this is only skin deep and it's not hit the muscle yet, and so it's not like there's anything too major, you know. Maybe just a sunspot, maybe it could just be a freckle,
It's
could
not
just be a
like-
mole.
It's not like cancer.
No, absolutely not.
Okay.
Absolutely not. Nothing.
Okay, thank
Nothing
goodness,
of that
thank
sort. Nothing. But we will need to take a sample of it to go to get a biopsy and make sure it is nothing. Do you mind if we clean it, take a little sample out?
Not at all.
And not at all? All right. Well, on the count of 3. All right. Let me just get disinfecting wipe in the area. All right. 1, 2. Hopefully that was not painful at all. Now we will bring this to the lab, run some tests on it, make sure you'll be okay. And do you have any more questions for us?
No, that would be all.
It's
fine.
It shouldn't take too long.
Yeah. Just when are we getting my lab results back? Like,
There's plans.
Bye. 4 days later.
Welcome back. Welcome back.
It's been quite a long 4 days. Not gonna lie.
Quite a long 4 days, you say. I'm sorry it took so long.
Yeah.
I said earlier we were a little understaffed.
Okay, I understand.
Wish we could have got back to you a little sooner. I'm so sorry about that.
Oh, you're good.
So how's your day?
My day's been fine. Yeah. What about you, sir?
My day's been pretty great. Have you had breakfast?
Yeah, I had. What about this lab? Sorry, I had breakfast.
What did you have for breakfast? Like anything nutritious, healthy?
Yeah, I had cereal. What about the
Cereal?
lab?
Oh,
Like,
the lab. So regarding the lab,
How do we say this?
it's nothing major.
Okay.
It's nothing.
Okay.
It's nothing too much to worry about. You shouldn't be too worried. There are treatments with it. There's stuff to do to
Yeah,
prevent it. There's.
what is it?
It's kind of hard.
The lab's back, she's got cancer.
Well,
Is he for
Dr.
real?
Tibula.
Oh yeah, what?
Did
My
you-
lunchtime, what?
It's okay.
What?
No, it's okay.
Is this for real? Is it actually cancer?
It's unfortunately yes, but it's very early in the first stage. It's very early, very treatable, and it'll be okay. You'll be all right. There are some treatments with it. There are some things you can do with it. Anu, would you like to go?
All right. Yes. So some things you can do to ensure that your melanoma doesn't get any more severe is you can make sure you put sunscreen on the area. Have you been doing that?
I try my best, but sometimes,
Okay,
girls got a
well-
tan.
We'll write you a prescription for that for sure to make sure it doesn't get any worse.
Okay.
Also, in general, be aware of your sun exposure. Make sure you aren't going out too much in the sun, especially when you haven't put on sunscreen, because UV rays are very damaging to your skin cells.
When you do go out and put on sunscreen, please remember to reapply every hour or 2 hours, and be sure to put enough because a lot of people do not put enough, and very harmful for you. Remember to put enough.
We also might need to discuss some surgery options.
Oh, okay.
Like, have to cut off your arm or anything. But,
No amputations. It's, like I said, very early in stage 1.
like, I
But we're
know
alright.
that's what we said last time, but.
There are other options such as laser and Dr. Sibula.
Update, it's terminal.
Please stay, Dr. Sibula. So we can actually refer you to somebody, and Dr. Sibula is the best person.
Laser surgery?
Yes,
Alright.
he is the best person we can refer you to, and we hope that you enjoy it. You can go to the front desk. Nancy's over there, and I hope you
I will schedule my surgery, yeah.
schedule the surgery.
Yeah.
You know, good luck with everything.
Yeah, thank you so much, doctor.
Of course, and we will see you again. Dr. Sibula will see you here again sometime in the next maybe 3 years.
Yeah.
All right, thank you.
Thank you, bye.
Bye.
Thank you.
Guys, what was that?